I think we dovetail on emotional support, because I think we're both trained well to do that. So social workers, I think, are really, from my perspective, help a lot with the financial aspects of what someone is going to be facing or already facing. So people walk through the door with already existing issues. The diagnosis certainly just adds to them, and we've learned that. So it could be immediately needing housing, food. People are homeless, they get diagnosed. So I think the social worker starts with those social aspects of finances, housing, transportation. Huge barrier for our community here is transportation. How will these people get to and from when they live, in South County or they live miles away? Coping, techniques on how to cope, breathing techniques, meditation, mindfulness. So I can see immediately where that is kind of a list that they help with immediately. And then the nurse navigator is more, I like to look at us as, we're the liaison between the doctors and the patient, so we have a lot of answers for some of the medical questions. Certainly, we can explain it a little more. We can accompany them to appointments to help them better understand what's being said. Discuss medications. We can outline, talk about the diagnosis, the possible treatments coming their way, what they can expect from the treatments. So I think we take a little bit, we're kind of the medical side of it for the patient. Maybe the way the doctor said it, I heard most of it, but could you say it again? And so perhaps sometimes we can change how we present it. That might make a better understanding. Many times so the good news is I always like to think, well, we have access through the back door, so we can always go to a doctor's office and say, so this patient is struggling with this information or that information. Can you help me understand too, so I can better go back and help them? Because we really partner together. It's just really a partnership across the board between the patient, the nurse, the doctor, everybody. So I think we help each other. If I can help the patient understand, then that's going to prevent another visit or phone call to the doctor. So I think we try to help them make sense of it. I think the more they understand, the better for them. Not everyone's interested in that. Some people just are not of that belief, and they feel like whatever the doctor says, I'll just do. And then you have the other spectrum where they want to know everything and they're well educated. I think that, as I said, to make them successful to live with their disease, whichever works, but the more they want to know, we're certainly willing to help them get that information.